So I get a lot of questions on the Lapidus procedure. There's a lot of advertisements for it. So just a quick video on the differences between minimally invasive surgery and the Lapidus procedure. The Lapidus procedure is not minimally invasive. It definitely has a larger incision, which is going to create more scar tissue, higher risk of nerve damage, those types of things. The biggest difference, however, is really the type of procedure. So the Lapidus is fusing a joint in your foot. The first metatarsal cuneiform joint is what it's fusing. And fusing a joint is always a lot more difficult. Your body does not want to fuse joints. Your body wants to keep joints moving, which is why they have to use a lot of hardware and keep that thing rigid, and why you generally have a lot longer recovery periods, because you need to keep absolute stability. So there's long periods of non-weight bearing, long periods where you're in a cast or a boot, and long periods where you're having to recover. The minimally invasive techniques that I do, conversely, work very well with your body. Your body is literally built to recover and heal bone fractures. So humans evolved to heal bone fractures very well, back to 100% strength and function, and the bone remodels based on the stresses you put through it. So your body's really designed and is very good at healing bone fractures. Essentially what I'm doing with a minimally invasive surgery is I'm doing a strategic fracture in your first metatarsal, moving the bone into a better position. The bone heals on new position. So we're essentially just leveraging your body's ability to heal by doing a small bone cut. For a bone surgical fracture, essentially precise surgical fracture, what we call an osteotomy. Put that bone into the position that we want, and the bone heals in a straightened position. So the big toe is nice and straight, realigned, all the tendons are realigned, and the big toe joint's more functional and obviously a lot less painful. It's not going to cause problems. So we're really working with your body versus working against your body. That's why we don't need rigid internal fixation. I do use a temporary pin to kind of give me the stability that I want. Kind of works similar to a cast. If you had a broken arm, you put it in a cast. It doesn't need rigid internal hardware. It just needs to be held in position while the bone heals. The pin that I use is essentially doing that, keeping that bone in the right position while it heals. Your body's going to heal that fracture all by itself once the bone is stable. We pull that pin out so you don't have any ugly screws, any plates, or any irritating hardware that might need to come out in the future that can cause a lot of swelling, a lot of irritation, a lot of nerve issues. So the temporary pin is kind of alleviating the need for any internal hardware and creating a lot less potential for problems. So at the end of the day, we pull that pin out and there's no hardware left in your foot. So because of that, you're able to walk right away. We want you to load that foot right away. We want you to act as if you had a fracture in your foot. So you basically want to start increasing your weight slowly over time, using pain as your guide, and your body's going to heal that fracture just with that big toe now in a straight position. So in this way, your recovery is way faster because you're loading your foot immediately after surgery, and then you're building back to a normal level. So you're obviously loading it less initially, and then by 12 weeks, you should be fully loading that foot. People are running and jumping and climbing and doing their skiing and biking and everything they want by 12 weeks. So the recovery is a lot faster. You still have a little bit of swelling usually at that point, but that's close to being resolved at that 3-month mark. So that's the main differences in the Lapidus versus the minimally invasive techniques that we do at Northwest Surgery Center. So I think that's about it.